Hello and welcome to this presentation on vitamin D and COVID-19. The interest in vitamin D has increased tremendously over recent years, and this has now come into even sharper focus with the current COVID-19 pandemic. Today's presentation is going to look at a study focusing on vitamin D and its potential to reduce infection rates simply by having sufficient levels in your blood. Let's start with an overview of COVID-19. What is COVID-19? COVID-19 stands for Coronavirus Disease 2019, which is the year in which it was discovered. The majority of people infected with COVID-19 virus experience mild to moderate respiratory illness. They have symptoms of a dry, persistent cough, fevers, loss of taste, and loss of smell. There are patients that will suffer more serious health complications potentially. Now, this is due to things like underlying medical conditions such as chronic respiratory disease, cancers, diabetes, cardiovascular disease, but also another susceptible cohort of patients would be the elderly. Now, with treatment uncertain, things are ever changing currently with the treatment of COVID-19, and vaccines currently unavailable, albeit them being worked on, other areas are being explored as a way to reduce infection rates. So moving on from COVID-19, we get to vitamin D, the other part of our presentation. Now, vitamin D is a vitamin that's only attainable through things like sunlight. That's the main one. Sunlight, so it's called the sunshine vitamin. Also dietary supplements and some food sources. Things like oily fish, livers, egg yolk and red meats will be at low levels, and then fortified foods. Oily fish, things like salmon, herring, mackerel, and then livers, we could think about things like cod liver oils, for example. Adults typically require around 10 milligrams to 20 milligrams per day, or 400 international units to 800 international units per day to maintain sufficient levels. Now, that's obviously providing that you have sufficient levels when you start taking those supplements. Now, what does it do? Now, calcium and phosphate homeostasis is normally governed by vitamin D. It's also recognized to have an immunomodulatory and anti-inflammatory property as well, which is why it's anticipated that vitamin D has a relationship with viral infections and mortality potentially from COVID-19. So what is 25-hydroxyvitamin D? It's the major form of vitamin D that circulates throughout the body, and it's therefore the best indicator of vitamin D level for a person. Now, this image here shows the synthesis pathway of vitamin D. UVB rays from the sun interact with the skin, and 7-dehydrocholesterol within the skin is converted to cholecalciferol, also known as vitamin D3. Cholecalciferol in the blood enters the liver, where an enzyme called 25-hydroxylase converts cholecalciferol into 25-hydroxyvitamin D. Could there be a link between 25-hydroxyvitamin D and COVID-19? Well, Professor Michael Holick of Boston University in America did a study to see just that. He measured the 25-hydroxyvitamin D levels in 190,000 people across all 50 states of America, and he used the results to see if a low vitamin D level made a person more susceptible to contracting COVID-19, and his results were very, very interesting. So what were the findings of Dr. Holick's study? He found that there was a strong correlation between having sufficient 25-hydroxyvitamin D levels and lower SARS-CoV-2 positivity rates. SARS-CoV-2 is the virus responsible for COVID-19. So the higher the 25-hydroxyvitamin D level within the blood, the lower the risk of being infected with coronavirus essentially. And patients with lower 25-hydroxyvitamin D levels, so less than 20 nanograms per milliliter, had a 54% higher positivity rate. And interestingly, this was particularly apparent among patients from African American and Hispanic backgrounds. The study found that having a higher blood level of 25-hydroxyvitamin D would reduce your likelihood of infection of COVID-19. So how do we achieve these? So we're looking for at least a 30 nanogram per milliliter level of 25-OHD. Now, in infants, this would require supplements of 400 to 1,000 international units. Children, 600 to 1,000 international units, and adults, 1,000 to 1,500 international units. Obese adults would actually require 2 to 3 times more. Now, a simple sentence from Dr. Holick: the simple and inexpensive intervention of taking vitamin D can significantly help reduce risk of infection by this deadly virus. How can we put the information that the study has found into practice? Now, we know that vitamin D is essential for good health, And despite this, 42% of adult Americans are vitamin D deficient. Another study by Aloia et al. In 2008 showed that 1,120 to 1,680 international units were necessary just to maintain the levels of vitamin D within the blood for a healthy adult. With this in mind, if you are a vitamin D deficient person, it's recognized by this study that you need up to 5,000 international units per day to reach normal blood levels, and then obviously you would then have to go and maintain that with other supplement. Essentially, in order to manage our intake, we need to know what our vitamin D levels are to start with. After all, Lord Kelvin once said, if you cannot measure it, you cannot improve it. This is where Your Personalized Vitamins has a solution. Your Personalized Vitamins has a rapid home self-testing kit for the quantitative determination of 25-hydroxyvitamin D within the blood, the number that you need to know in order to get the correct amount of vitamin D supplementation for your body. It's the world's first quantitative home test kit, which allows results within 20 minutes. So some other points to note regarding Your Personalized Vitamins. As I've said, it's the world's first quantitative vitamin D home test kit, which allows results and gives you your results within 20 minutes. Once you've got your results, you can then get this supplementation program. It will look at your results and it will say, okay, this is exactly what you need in order to become sufficient and then to maintain your vitamin D levels throughout the year. There's regular testing, so it's not like you have one test and that's it. You can have more tests. You test again, you then see what you're like in the winter, what your levels are looking like in the winter. Has the fact that you're now indoors instead of going out in the sun and sitting in the park, has that changed your vitamin D levels? Are you supplementing enough and taking that into account? You also have access to healthcare coaching as well regarding your vitamin D. And it's a cost-efficient and effective method of managing your vitamin D supplementation throughout the year for your optimal health. So how do I get the ball rolling with regards to Your Personalized Vitamins and sorting out my vitamin D supplementation? It's really, really simple. Visit yourpersonalizedvitamins.co.uk/subscribe, choose your plan and get testing. References that were used within the presentation today are shown here. Finally, thank you for listening. If you need any further information, please visit www.yourpersonalizedvitamins.co.uk and start your vitamin D journey now. From all of the staff at Your Personalized Vitamins, thanks for listening.